I'm Dawn Olson. I'm a family practice nurse practitioner at Grande Itasca. I think for the most part we do see an increase of activities and injuries in the summertime as kids are more active and playing sports and being outdoors. Most of the injuries that we see kids coming into the clinic for are scrapes and bruises, cuts. We get some injuries such as sprains and fractures and head injuries. If you think your child has a broken bone or a sprain, the most important thing is to get them in a comfortable spot. We want to check them out and make sure that there's nothing sticking out of the skin that needs anything emergent. From there, we recommend just making sure they're comfortable. We use RICE treatment, which is rest, ice, compression, and elevation. If that pain is persistent, if it seems to be more than what would be expected, we would want you to come into the clinic and have that evaluated by a medical professional. So safety precautions we want to make sure we're taking for kids when they're out playing in the summertime is making sure they're wearing a helmet if they're riding their bike or riding scooters or rollerblades. Things like elbow pads and knee pads can be really helpful as well. As far as playground equipment, trampolines, we want to make sure those kind of things we've checked in the beginning of the summer because over the winter months those can start to deteriorate. We want to make sure everything is safe and working properly. If your child gets hit in the head, first and foremost, if they have any loss of consciousness, they need to be seen right away in the emergency room. If they haven't had any loss of consciousness, you want to just make sure you're watching them, look for changes in behavior, looking for any nausea or vomiting, any confusion, any changes in their coordination. If you're noticing any of those kind of symptoms, you want to try to keep them awake and then get them to get some medical professional help right away. Cuts, scrapes, abrasions, those are all really common in the summer months as kids are outside playing in the dirt, riding their bikes. If your kid has a mild scrape or an abrasion, you just want to make sure you wash it really good with some soap and water. Make sure you get any debris out of there. Putting some antibiotic ointment and a bandage or gauze over that can be really helpful just to keep it clean and protected. You want to change that every day. The best way for those wounds to heal is to keep them covered and warm, but you want to change that bandage every day. If the cut or scrape seems to be deep or you're having trouble controlling the bleeding, you want to put some pressure on that and then get some medical attention for that to see if they need something like staples or sutures. Grande Itasca Clinic and Hospital, your partner in health.